Educational theory can be very useful in practice. Take this example.
The learner had been having problems being reflective in their learning logs, which is a common enough complaint from trainers, but it had reached a level where the learner was not actually learning and it was affecting her performance. The learner was relying very heavily on the trainer for clinical advice, and often that was repetitive with a similar or same scenario from one she'd previously asked the trainer, which causing a certain degree of frustration both on a day-to-day basis and also in terms of looking at their learning logs. So having tried a number of other things and general advice, looking at the logs together, trying to prompt the learner to take their own thoughts and carry them forward, the trainer then thought of giving them a reference of Bloom's taxonomy or hierarchy of verbs and asked them for the next tutorial to look at their own learning logs that they had been submitting, literally analyse the kind of verbs that they were using in the log. And the verbs that were being used were mainly saw or heard. I saw this, I heard this. And then for the learner to bring this to the next tutorial, having read the hierarchy of verbs and look at other activities that they could potentially be engaging in. So the learner did do this, came back and was really interested to see the other kinds of activities that could have been taking place. So analysing, comparing, planning. What this learner hadn't been doing was working out why in patient A did she see the trainer giving an antibiotic, when in patient B she saw the trainer doing a 2-week wait cancer referral, and in patient C giving an inhaler. So then every time she had a patient with a cough, she was thinking, well, actually, do I give an antibiotic, an inhaler, or do I send them on a 2-week wait referral? And all those questions were coming back to the trainer. But by comparing and analysing what it was about the different patients, she was actually then able to put into her practice the ability to deduce what was going on from the symptoms the patient was describing.
This led to a shift for the trainee, who was able to progress both in practice with managing patients, as well as being able to commit high-quality reflective entries in the learning log. Progress was made both clinically and in terms of workplace-based assessment.
The change for the trainee in terms of using these tools was to look a lot more deeply at the problem, engage more actively in what was going on, and then that led her to be able to make deductions about future clinical encounters.
In her role as Associate Director for Trainees in Difficulty, Rachel was called in to visit a learner who'd failed his AKT, or multiple choice exam, quite badly on 2 occasions. Based on case-based discussions and tutorials, the trainer suspected that learning had become quite superficial.
I started by asking the learner to describe how they learnt for, say, their last tutorial, and secondly, how they learnt for their last exam. So for the last tutorial, it had been on hypertension. What was described to me was that he read the page or looked at the lists, say, of drugs. What seemed to be missing was anything beyond that. So, for example, there was no highlighting of sections, there was no drawing of flow charts, there was no comparison with other bits of paperwork that he might have read on the topic. There was no comparison with what had actually been done for patients he'd seen previously.
The learner was simply learning the answers and was not engaging to work out why the answer was correct in that situation.
So actually during the exam he felt that the same questions were coming up and he was just putting down the answer that he had learnt from the time before. And it seems that he probably misread some of the questions or even just assumed they were the same, but certainly didn't think through what the question was asking. So to try and make sense of Bloom's taxonomy for him, I suppose I tried to relate it to, say, if you're trying to get physically fit, because I felt this maybe rang a bell a little bit more with him, and that if you were in a gym, that you actually have to really engage strenuously with the activities. You have to raise your heart rate, you have to sweat a little bit, and then you get the better results. So again, looking through the hierarchy of verbs where you're really struggling with the concept, really trying to work out what's going on, make sense of it for you, link it to the patients you've seen, work out what you would do if actually something went wrong so you couldn't take the first logical step, analyse it and synthesise and make plans. That he did actually understand what was missing.
The learner needed to think about what he was physically doing to learn the topic, what he did when he opened the book.
Well, for me, I have to say I was incredibly impressed by the talent of the first trainer in knowing how to select an appropriate tool and use it for an appropriate learner to dramatic effect, one that allowed the learner to progress successfully and for the trainer to feel much more fulfilled. Secondly, I'm still waiting for the outcomes for this particular learner in difficulty, but I have had feedback from the trainer who's found that he can now analyse even the evidence-based practice questions, so the statistics questions, things that translate statistics into everyday practice, which for him was by far the most difficult. So, I'm really encouraged that progress can be made for all learners.
Here are some questions that are intended to get you thinking about this subject in greater depth. What are the links between Bloom's taxonomy and the programme about learning styles? Can you give an example of where synthesis has affected your clinical practice? There's a more detailed account of Bloom's taxonomy in the video programme on curriculum planning and in our e-learning module on setting learning objectives. Go to faculty.londondeanery.ac.uk/e-learning and select the topic from the left-hand panel. If you're a student on our postgraduate certificate course, you'll find references and suggestions for additional reading within the online resource folder.